Hey guys, in this week's video we're looking at how to recover from COVID-19 at home. In this week's video we're going to be talking about everything you need to know about your recovery, from what to do, from what you need to monitor, how to help with fevers, breathlessness, coughing, everything you need to know about recovering. And also, most importantly, we're also going to be discussing when you should start seeking medical attention. So with all the monitoring that we're going to do and discuss in this video, you're going to know when you need to start seeking that medical attention, the most important thing. Now, before we begin, it's super important to remember, if you do need to seek any medical advice from your healthcare professionals, please call them. Do not go in unless you are informed to come in, and they will describe exactly what you need to go in. Also, please remember, this video is all about your recovery and what you need to do that's going to help. It's not there to replace any medical advice, so please remember that as well. And please remember that if at any point you feel like you're struggling to complete sentences because you're so short of breath whilst resting, you're coughing up any blood, or you've just seen a sudden deterioration in your breathing, plus any of the information in this text box that's going to be here, you need to call 999 immediately for emergency medical assistance. Okay, so that's the important bits done. Now let's learn how you can recover from COVID-19 at home and what you need to do. Please remember, this is going to be quite a long video, and I understand you might not want to watch the entire video. There might be certain sections that are of more interest to you. So we've chaptered the entire video. Feel free to click on the description below, click on the section that you need and watch it. However, as I always say in every video, I'd highly recommend that you watch the entire video because there's just so much to learn. So about 3 months ago, I actually had COVID-19. I caught it from someone whilst working in general practice. Thankfully, I recovered very quickly. I was double vaccinated, and the recovery process for me was quite easy, and I didn't have any long COVID, so I didn't have any symptoms that lingered after my recovery period. Now, one of the things that I did notice whilst I was recovering from COVID is that it can be quite daunting. So if you're watching this video and you're a bit worried, you're a bit concerned, look, you need to try and stay calm and collected. That's one of the most important things that you need to try and do whilst you're recovering from COVID-19. And I know it can be daunting. Even me as a healthcare professional, I felt a bit worried and nervous as well. But you've got to remember, you can hopefully recover. And you're gonna know as well, you've got to remember what to look out for and when to seek medical attention. That's probably one of the most important things. And we're going to go through all of that in this video. Now, whilst I was recovering from COVID-19, I actually made myself an Excel spreadsheet like template for recording all my different vitals, because I didn't find anything online to help with this. So I'm going to share that with you guys as well. I'm going to leave a link to it in the description below, and we're going to work through this spreadsheet on recording your vitals, recording different things, and also using it as a reminder to do certain things. So please feel free to download that template now. And throughout the video, I'm going to keep referring to it, so it might be useful to have that and just click on it just to see exactly what I'm talking about. Now, let's begin. Okay, so let's begin with the first point, breathing. Look, if you're experiencing any form of minor breathlessness whilst you're self-isolating with COVID-19, one of the first things you need to do that's really going to help is open your windows in the room that you're staying at, in the place that you're staying at whilst you're self-isolating. By opening the windows, you're going to get fresh air in, and remember, you don't want your room to be too warm. Warm air can actually make it a bit more difficult to breathe. And also remember that using a fan, for example, to cool you down isn't really going to help that much with breathing. Also, it's going to help spread the virus around, and we don't want to do that either. So the first thing you really need to do is open up them windows and get some cool air in, and this is going to help with the breathing as well. Okay, so now that we've cooled the room down a little, the next thing I want you to think about is positioning. How are you sat right now? Are you slouched or are you sat upright? Sitting upright is really going to help with our breathing, making sure that you're not slouching, and make sure that your shoulders are nice and relaxed. All of this is going to help with breathing and make it easier for us to breathe. Another thing that I'd like to discuss is, remember, with COVID-19, we need to try and keep our airways open as much as possible. So if you can, if you've got the energy during the day, try not to lie down too much. And if you're gonna lie down, make sure you're not lying down flat. Make sure you're kind of lying upright with your back raised, okay? This is gonna make a difference with our lower airways closing. If you're gonna be lying down constantly on your back, your lower airways will close, and it's not gonna help with the breathing. So for myself, for example, when I was recovering from COVID-19, I was actually working from home, so I was sat throughout the day on my chair, upright, in an upright position and a straight position like we've just discussed, to help with the breathing. Now, if you can't sort of stay upright all day, if you're getting tired, if you don't have the energy and you want to lie down, just again, make sure that you're lying down at a 45-degree angle. So you're sort of lying in bed, but you're upright as well. That's really gonna help. And if you do want to sleep as well, try not to sleep on your back. Again, try and sleep on your side or on your belly. This is all gonna help with keeping those airways open. So that's a few tips that you can do that are gonna help with breathing. Now, if you do look at the spreadsheet as well, I do have a little reminder every 6 hours or so reminding you to try and do a bit of a breathing exercise. I find the pursed lip breathing technique very useful at just calming you down and helping you get that natural rhythm again. And it's very easy to do. All you're gonna do is breathe in from your nose and then breathe out from your mouth as if you're whistling. You need to take about twice as long when you're breathing out compared to when you're breathing in. So I'll just demonstrate it for you now. So I'm gonna breathe in. So I kind of took twice as long. You'll find a rhythm as well whilst you're doing it, but please remember as well, it's not like a forced expiration, so it's not a forced breath out like I'm blowing a candle out, but I'm just pursing my lips and just naturally letting the air flow out. So that's an important factor to remember. Doing this for a couple of minutes, like 3-4 times a day, just helps get that rhythmic breathing back. If you are struggling with breathing at all, it can be quite helpful. Another thing that's really important to know is that while suffering with COVID-19, it's crucial that you do not smoke if you are a smoker. This applies to both cigarettes and e-vapes. Cigarettes contain a chemical known as carbon monoxide, which can replace the oxygen in your blood, making you feel even more breathless. And even e-cigarettes that don't contain carbon monoxide, they do contain nicotine, just like cigarettes. And nicotine makes our blood vessels get thinner. And when our blood vessels are thinner, that means less blood is able to go to our cells. For example, our lungs. So if we have less blood going to our lungs, we're gonna get less oxygen going into our blood and feeding our body. So we're gonna remain more breathless. So moving on from breathlessness, the next thing that I want to discuss with you are your O2 concentrations in your blood, or your O2 sats as we call them. This is super important as it shows us how much oxygen there is in your blood and how much oxygen is available to your cells. So monitoring this is really important, and if you look on the spreadsheet again, there's loads of little sections for adding your O2 sats every 6 to 4 hours. There's no harm in doing it more often if you want, but it's just on the spreadsheet for your vitals to go on there just as a reminder. So with COVID-19, it can be really useful to monitor your oxygen saturation levels because COVID-19 is notoriously well known for causing something known as silent hypoxia. This is when our oxygen levels are too low and our body doesn't realize it either. And when they're too long for a while, that's when we can get some real problems. So if you don't know what an oxygen saturation monitor is, I'll go get one from my bag actually. But I do have a video all about them and how to use them. So I will leave a link to it up here and in the description below. They look like that. I'm sure you've seen them before, and they go on your finger like so, and it tells you your O2 sats. So as mentioned, the best way to monitor your oxygen saturation is with a handy little device known as a pulse oximeter. It's a small machine that quickly and painlessly fits onto a part of the body, usually the finger. And for anyone squeamish, the good news is that it doesn't use any needles or any blood at all, and it's completely painless. So use a spreadsheet to track your readings every 4 hours, but you should also take a reading if at any point you start to feel more unwell. So the next question is, what percentage should our oxygen saturation be? Well, ideally, for a healthy adult, it should be between 95 to 100%. These are the sort of readings that are normal. And again, as I mentioned, if you want more information on how to use the oxygen saturation monitor properly, I do have a video on it going through loads and loads of information on it, really thoroughly actually. And again, how to monitor it and what to do when your levels start to drop in a lot more detail. So if you want more information on that and COVID, I will leave a link to it up here and in the description below. Now, if you find that your oxygen saturation drops to 93 to 94% whilst resting, recheck it again within an hour, and if again it's in that level, you need to contact your doctor, NHS 111, or speak to your general practice, get some advice from them. And if your oxygen saturations are 92% or less, and then you repeat it again and again it's 92% or less, by the way, you don't need to wait an hour this time to repeat it. You might wait a couple of minutes, a couple of seconds, and then do it again. Again, if it's 92% or less, you need to get emergency medical assistance. So call 999 immediately and make them aware of this. Please note, however, pregnant ladies, the oxygen saturation sort of lower threshold is much higher, and it's going to pop up here for you right now. Now, moving on to the next symptom with COVID-19 is the cough. A lot of people have this. I had it as well, but it was very minor. It was more of a tickly throat, to be honest, when I had the cough. But what I found really helpful for this is just sipping on water. It can be lukewarm or cold or cool water, that's not an issue. Also, sucking on lozenges or cough sweets can be really helpful just to soothe the throat, really. Another really useful option is if you have any honey at home and you're okay with honey, get 2 tablespoons of honey, mix it with some hot water and drink that slowly. This can be really soothing. I always find it really helpful, and to be quite honest with you, it's just as effective as the cough medicines that you can buy from the chemist or the supermarket. So don't bother wasting your money with all that. Just make yourself a nice little honey, hot water, and if you've got some lemon as well, put a dash of lemon in there as well. A little mix like that will really help soothe the throat. Please remember though, this is not suitable for children under 1. However, this video is for adults. Now on the spreadsheet that I've created, there is also a section for you to write how your cough is, if it's getting any worse, how often it's happening. These are the sort of information that you want to put on this vital spreadsheet that we've made. That way you can continue to monitor it and see if it's actually getting worse. And if it's getting worse and you're really starting to get irritated by it and it's causing you pain, then you should speak to your healthcare professional at this point. Make them aware that your cough is getting worse, because there are things that can be prescribed, such as inhalers, that can help with the cough. Okay, so the next thing that I want to talk about is your temperature and signs of dehydration. Everyone can monitor their temperature at home. All you need is a thermometer. Most people have one at home. And if you look at the spreadsheet again, there's a reminder on there on your vitals section on adding your temperature every 4 to 6 hours. So the next question is, what is a fever? What numbers are we looking for? Well, if you've got a thermometer here in the UK, anything above 38 degrees Celsius is what we classify as a fever. In America, where you guys use Fahrenheit, anything above 100.4 Fahrenheit is a fever. These are the adult ranges, by the way. We're only talking about adults in this video. Now, if you don't have a thermometer, you can just touch your chest, for example, or your back, and if it still feels hot, then most likely you've got a temperature or a fever. Also, please remember that when you're using a thermometer, the range might not be in fever category, so it might be, 37.5 degrees Celsius, let's say, but you still feel hot and shivery. This is still technically a fever. So whilst you're recovering from COVID-19 at home, whilst you're isolating, it's very common to have a fever. I had a fever for about 3 to 4 days. I think the highest that my temperature went to was about 38.5 degrees Celsius. But please remember, you might be different. This is just my experience that I'm telling you. So by having a fever, it's your body's natural defense system. It's trying to increase the temperature to try and kill the bacteria or viruses that might be in your body that are causing it. So it's just a natural process. There are things that you can do to help with the fever, for example, by drinking plenty of fluids, staying hydrated, and also there is medicines that you can take as well. For example, paracetamol, ibuprofen can be taken to help with the fever. Please do read the information leaflet that comes with it to make sure that you're safe and suitable to take the medicines before you do so, because that is the most important thing. So please bear in mind, even though these medicines are easily available to buy, they are not always suitable for everyone, especially if you're currently pregnant, breastfeeding, or have any underlying medical conditions. So always speak to your healthcare professional first to check. It's going to be difficult whilst you're isolating, so you can call them, you can call your pharmacy, or you can call NHS 111 to do this check. So one of the most important things to remember whilst you've got a fever, whilst your body's so hot, you're going to be losing a lot of fluids. The way that I like to describe it is, imagine you've got the radiator, I think you can see the radiator, you've got the radiator on and you've washed your clothes or t-shirt or something, you want it to dry quickly, you put it on the radiator and the water all evaporates and it dries really quickly. This is essentially the same thing that's going to happen with your body. When you've got a fever, you're going to be losing a lot more fluids. It's going to be evaporating, so you need to make sure that you are hydrated. And your wee colour needs to be, a light yellow. If it's getting dark, that can be a sign of dehydration. So if at any point you feel like you're going to the toilet to wee much less, also your wee colour has become really dark and you're feeling lightheaded, you're feeling faint, you're feeling really weak, these all could be signs of dehydration. If you're having any of these sort of symptoms, speak to your healthcare professional about it, don't leave it. And as well, make sure that you're staying hydrated. So we need to be drinking a minimum of 8 glasses of water a day. So here's where the spreadsheet comes into play again. It's really important that you're going to see on the spreadsheet, you're going to keep monitoring your temperature, putting it down, and you're going to be able to see trends. Healthcare professionals love trends. We love to check your vitals, to check for any differences and how you've been going and monitoring if there's any improvement. This is going to be great for you as well on reassuring you and helping to keep you calm, because you're going to start to see improvements hopefully as the days pass. The temperature's coming down, things are improving. This is why the vital spreadsheet can be so handy. Okay guys, moving on to the next topic, which is all about your blood pressure and pulse. We're going to monitor these as well because it can be really important in monitoring how you are recovering from your COVID. So blood pressure is the amount of force exerted from the heart to push the blood all over the body, and your pulse is basically your heart rate, how many times it's beating per minute. So by monitoring these and checking it not going too high or too low can be critical for seeing how you're doing on terms of your recovery. So in terms of your blood pressure readings, we're going to talk about rough readings now, but a good blood pressure is up to 120/80 millimeters of mercury. That's what we measure it in. So 120/80 is really good. But if you suffer from high blood pressure, anything from up to 140/90 is still acceptable, and you'll know your blood pressure better than anyone else. So if you know that your usual blood pressure is 150/90 for example, then that's pretty much the norm for you. However, if it is that sort of level, you do need to speak to your healthcare professional once you've got better from COVID to try and reduce it to a lower range, because high blood pressure can cause so many problems. But regardless of that, we're moving back onto COVID. So remember, the sort of general numbers are, if you're a healthy individual, up to 120/80 is a pretty normal blood pressure. And in terms of pulse, again, it varies from person to person, and it can be from about 60 to 100 is a normal beats per minute pulse. However, remember, it varies. If you're an athlete, you might naturally have a very low pulse. And if you're just a normal individual, you might have a bit of a higher pulse. But 60 to 100 is what we're saying is normal for the pulse. So it's important to utilize a spreadsheet to note and keep an eye on your blood pressure and pulse every 4 hours or so, and look for any changes in what is normal range for you. If you find your blood pressure or pulse is consistently out of what's normal for you, then please speak to your healthcare professional. So by doing these readings, you're going to see what's normal for you, and now you're going to know when to seek medical attention. So for example, you know your normal ranges after a while, but then if you notice that your systolic blood pressure reading, so the first number, which is the higher number, drops below 110 or goes above 180, you need to seek medical advice. And also, if you notice that your pulse, I said that the normal is between 60 to 100 last time, but if you notice that your pulse is dropping beneath 60 or above 120, again, you need to start speaking to your healthcare professional. Any of these could be a sign of sepsis, for example, or pneumonia, or something's happening that you need to start seeking medical attention for. That's the most important thing. If they start to go out of range, this is a great way to keep an eye on them by using the spreadsheet and using your blood pressure monitor, and then seeking medical attention when it's appropriate. So I really feel like we're starting to get somewhere now. We've discussed breathlessness, we've discussed coughs, temperatures, and as well as your blood pressure and pulse. So we're now really starting to get somewhere. I really do hope you find this information helpful, and if you do find it helpful, please do share it to friends, family, loved ones, whoever, and click that like button as well, just to give me some positive vibes and energy. So the next thing I want to discuss to you about the spreadsheet is the other notes section. I found this section really useful for myself for monitoring things that are quite unique to yourself. So for example, if you're coughing, is it productive? How productive was it? What color was your sputum? If you've got any pain anywhere, any sort of other symptoms that are going to be quite specific to you, you can monitor them on there. And the great thing about it is you can then monitor it and see, oh, actually 2 days ago I had that and I've got a lot better now. Or, for example, I had a bit of a sore throat for about 4 or 5 days. And to begin with, I wrote, sore throat on the other section. And then as the days passed, I was like, actually the sore throat's getting better, so improvement. So then you can see those improvements, and it's going to keep you calm and collected. It's going to help you just carry on with it and get better sooner. So as I've mentioned, by using the spreadsheet, you're going to be able to look for trends and see how you're improving or getting worse. And it's also going to be really helpful for your healthcare professional if you need to speak to them, because having these spreadsheet notes to hand and detailing when, how long for, and how severe these symptoms have been will also help your healthcare professional understand how you've been feeling, and it will also help them with their decision making as well. So moving on to the next topic, which is medicines. On the spreadsheet, we go through, we have different sections for different medicines you might take. I put paracetamol and ibuprofen on there because they're probably going to be one of the most common medicines that people take whilst they've got COVID. But the reason I've got them on there is it's going to be like your drug chart in hospital, and it's going to be really helpful for you to remember what time you took it and what dose you took. For example, we know paracetamol, you're meant to take it every 4 to 6 hours, okay, and it's a maximum of 4 doses in 24 hours. So by having it on the spreadsheet, it's going to be like a drug chart. You're going to remember, oh, actually, I had a dose then, so I can't have any more, or whatever reason, but you're going to be able to monitor it and make sure that you're safe. That's the most important thing. And also, if you're having to take any other medicines, then feel free to just add a column. I might just leave a spare one on there so you can just add it on there to make your life easier. Okay, so the next topic that I want to discuss with COVID-19 recovery at home is food and hydration. Look, when you're not feeling well, you might lose your appetite slightly, but it's really important that you're getting in the food, those foods that are healthy for you and nutritious to keep your body going, because your body is going to be using a lot of calories to beat this virus. So you need to make sure that you're eating regularly. There's sections on the actual spreadsheet to remind you to write notes on what you've eaten, and also there's a section on there about how many glasses of water or drinks you've had in general. Remember, any drink counts to your daily intake, so a coffee, a tea, all that sort of stuff counts as well. So it's not just glasses of water, but again, they're just helpful reminders to keep you going, because your body needs that hydration, especially if you've got the temperature like we spoke earlier, and it's going to be using all those calories. So we need to give the body as much nourishment as possible so it can fight the virus, get rid of it, and help you get better sooner. And hopefully you'll be watching this video afterwards and you're recovered and you'll be feeling great, and then you can carry on with your life and finish self-isolation. So we've now come to the end of this week's video. I really hope that you find this information helpful. If you're someone who's suffering from COVID-19 right now and you're self-isolating and you're recovering from home, I really hope that these tips help you and you get well soon. Please leave a comment below, let us know how you're getting on. Let us know what you found useful as well, because I'm sure other people watching this video will find it helpful too. You now know everything about the symptoms, you now know about what to look out for, which is the most important thing, because you're going to know when to seek medical attention. I want to have a little text box come out here again with those symptoms for you to be aware of, or when to seek medical attention. And remember, if you just feel like you're not getting better and you're getting worse, seek medical attention. Don't just wait, okay? That's one of the most important things. Everything I said in this video is a general thing, but everyone's unique, so you might have different symptoms to other people. You know how you're feeling. If you feel like you're not feeling well, speak to a healthcare professional. Don't just leave it. That's one of the most important things. I really hope you find this information helpful. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.